Beach is under a public health emergency. A tuberculosis outbreak at an unnamed hotel may have exposed up to 170 people to the disease. One person has already died. 9 others have been hospitalized. With more, we are joined by our Fox 11 medical contributor, board-certified emergency room doctor, Dr. Michael Daignault. Good to have you on this Friday night. How serious is this tuberculosis outbreak?
Well, we've been talking about this a number of times over the last few weeks, especially when the California Department of Public Health issued that warning to physicians to keep an eye out for TB cases. And as I mentioned, it can happen in congregate living situations such as a hotel like this. And so here we have the first significant outbreak. And as we've mentioned before, the rates of TB are going up in California, across the country, and they have been in the last few years since the pandemic kind of subsided. But in general, the risk to the public remains very low. I mean, as opposed to COVID, where you have to have a lot of prolonged exposure in one room, for TB, it's going to take much more than that to get you infected. So it's much less likely to affect the general public. Okay,
so it's just those 170 who were exposed the big worry lies with. But if you're in the general population, not to worry as much.
Right, and the department, by making it an emergency, they're able to track everybody very effectively and make sure they get tested.
And we learned how important tracking is when it came to COVID-19 as well. Okay, some new guidelines were announced this week recommending earlier breast cancer screening. So now they're saying you should start you should start at age 40.
Correct. Yeah, and this is a big change because it used to be 50, and they said between 40 and 50, it's a personal decision with you and your doctor. But we saw from 2015 and 2019, every year there was a 2% increase in breast cancer in women in their 40s. So that played a huge role in making this announcement. The other thing that's really important is that the United States Preventative Service Task Force, which issued this new guideline, they were behind the American Society of OBGYN and the American Cancer Society in making this recommendation. And it's important because insurers have to provide free mammogram coverage when the American Services gives that a rating of B or higher, that they need to have this done. And so the fact that they're in line with the other groups now, they're saying start at 40. This means under the Affordable Care Act, and insurance companies will have to cover the screening now for people.
That's a win. That's huge. That's big time.
Especially for
so
access.
Age 40, ladies, make your appointment. Okay, so we have our new segment, Ask the Doctor. So our question this week comes from Frank. It's a good question. Frank writes to us and says, I've been working out for years, weight training and cardio. Hey, Dr. D, why don't I have abs?
Right. This is a great...
You and me both, Frank.
It's a great question from Frank. And so there's a number of things we have to think about. Number one is genetics. It's something you don't have control over. Number two, it's your percent body fat. So between 10 and 14, if you get your body fat percentage down to 10 and 14%, those abs should just show up. If you aim for a percent body fat less than 10, you start getting into the unhealthy kind of range. The other thing you have to do is lift weights. Now, weight training, lifting weights has shown to burn more fat for a longer period of time than just cardio. And for those who already lift weights and you're not seeing your abs, you want to consider steady state or zone 2 cardio, which is walking on a treadmill 20 to 30 minutes at an incline. And also it's really important to track your macros, like really be aware of how much fat you're intaking as well.
Macros, I don't know what that means.
So your protein, your fat, your carbs, if you track those every day, like it'll really open your eyes to how much fat you're actually taking in.
Okay, Frank, there's your answer. Get back to us. Let us know if you have abs in, what, a couple months, maybe?
Yeah, send us a follow-up.
Yeah. If you want your question answered by Dr. Michael Daignault, you can send an email to askthedoctor@fox.com. Include your name and city if you want, but please no other personal information, and we'll get your answer for you live on the air with Dr. D. Thank you so much.
Thank you so much. Have a good weekend.
You too.